built in 1942, so it's got kind of a neat little history on it. All right, let's see here. Yep, 9 o'clock.
9 o'clock.
Good morning, everyone, and thank you for joining us for the meeting of the San Joaquin Valley Insurance Authority. We're going to convene this meeting, take up item number 1, which was a request to call the meeting to order. We've done so. Item number 2 will be the Pledge of Allegiance, and I was going to have the Senator Andreas Borges lead us this morning, but he's not joining us due to a Christmas program. So in his absence, I will have Supervisor Magsig lead us in the pledge.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I figured you got little kids. You're here.
I'm here. I mean, the senator has young children too, but I do as well. But I'm still here. County business is important when you're a county supervisor. Item number 2 on the agenda is Pledge of Allegiance. We've done that. Item 3 is roll call.
Okay, make it official, Director Borges.
Can we change, maybe on the next agenda, can we have it say Senator Borges on there? just for the heck of it.
I'll have to check Robert's rule.
Okay, check that, please. Thank you.
Good
answer.
Sorry for interrupting.
Director Suklian?
Chucklian. Here.
Sorry.
That's all right.
Chucklian. Thank you. Director Magsig?
here.
Director Mendez?
Here.
Director Pacheco?
Here.
Director Vanderpool?
Present.
And Director Wordley?
Here.
Thank you.
All right, we do have a quorum, and we will take up item 4, which is our first action item, which is a request to approve today's meeting agenda.
Motion to approve.
All right, I have a motion from Director Worthley, a second from Director Mendez. All those in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. Item number 5 is closed session. Council, do we still have need for closed session?
We do not.
Okay. We will not be meeting in closed session today. Take up item number 6, which is public comment. At this time, members of the public may comment on any item that is within the jurisdiction of the SJVIA, but not appearing on today's agenda. Is there anyone here wishing to speak under the public comment period? Seeing none, I will close the public comment period and move on to item number 7, which is the approval of the meeting minutes. A request to approve the minutes of the October 27th, 2017 board meeting.
So moved.
All right, I have a motion by Director Magsig, a second by Director Shuckley, and all those in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. Next, we have item 8, which is SJVIA Director questions, announcements, and activity reports. Anyone have anything for the good of the order? Steve, you want to talk about tree mortality or the dam, Temperance Flat, anything?
I'm going to talk about my grandson, but that's all right.
All right. Seeing no comments, we will move on to item number 9, which is a request to receive an update from the Auditor Treasurer on cash flow projections. Okay.
Alrighty. My name is Rhonda Cade.
Can you get closer to the microphone?
My name is Rhonda Cade. I'm with the County of Fresno Auditor Controller Department, and I hope you all are doing well this morning and have their Christmas shopping complete.
Getting started. What are you
Getting
talking
started. Ooh, that's what
At
we're
the
talking
conclusion
about.
of this meeting, I'll continue
If you
on.
don't do it.
Right. Okay, I'll be presenting on quarters 2 through the 4th quarter, ending June 30th, 2018. Starting the 2nd quarter, just to let you know, all of these charts are reflecting weekly averages as opposed to daily balances. 2nd quarter reflects mainly actuals up to the 2nd of December. Not too much happening here. We did have 2 days that went under the 3 million mark, and that was the 8th of November and the 12th of December. And that usually happens because it's right before the payday. And Tulare and Fresno, usually at the beginning of the month, deposit on the same day, which is a Friday. So right at that time, it usually gets pretty low, and then it carries us through the rest of the month. So just those 2 days in this second quarter was our low points. And as you can see, the increase is the two counties being deposited the same day. Okay, here goes the projection of the increase of rates starting January 1st, ending March 31st. I did speak with Board about this, looked at their 2018 final renewal package, and incorporated the rate increase for Fresno, Tulare, and Marysville, also adjusted expenditures accordingly. We do have a dental holiday in January as well, and that was recognized. And so as you can see, it's pretty stable throughout the third quarter. We are progressing and doing fairly well. So the fourth quarter, again, we continue to stabilize and do increase throughout the quarter. The two spikes there, again, are both Tulare County deposits hitting the same day. So this is the projection that we have. Again, I'll be bringing an update in February and have some actuals that go through as well. Any questions with this? I have one more slide, but just with this cash flow presentation.
Any questions? Sure nice not to see negatives.
I agree. So the last one, this is the last time I'm going to be reporting on Sutter claims right now. We're at the end, very little's coming in, so basically we have realized about 73% of the 1.6 that was calculated, so we're just a little over 1. Unless something significant happens, I'm just going to drop this. That concludes the cash flow presentation.
Any questions or comments for staff? Any public comments? Okay, seeing none, we will continue on with our agenda and take up item number 10, which is a request to receive and approve amendment number 1 to the Rail and Letson actuarial agreement.
Yes, Ron Decade, County of Fresno Auditor Controller Department. We did speak with Rail and Letson. We're currently working with them. He is finalizing the actuarial report for the 15-16, and I guess going through the contract, he noticed item 8 and the scope of services was not included in his RFQ. We examined that, and that was true, and so he was willing to do the service, but would need to just amend the contract to include that service. This is something that we do not need the actuary to do. If we do need it, we can request this from Keenan and Associates. And so instead of asking him to do this service, we're just updating item number 8. And what we are replacing is it will read a statement of incurred but not reported IBNR reserve calculations for the SJVIA. And so you see what the verbiage was before. We're just replacing it with that, and that's all this amendment will encompass.
Any questions or comments from board members, directors, members of the public?
Move for staff's recommendation.
Okay, we have a motion by Director Magsig.
Second.
Second by Director Worthley. All those in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. Okay, we're going to move on now to item 11, which is a request to receive and file the consultant's update on the SJVIA wellness activities.
Good morning. I will be presenting Rhonda Schuster, Human Resources, Tulare County, presenting this morning. This is an update on the various wellness activities by the SJVIA. Since our last meeting, we have completed the mammography screenings. We did 254 screenings total in both of the two counties, as you see there, Fresno County 78 kiosks that they would be providing that are the live health online kiosks where employees will be able to come in to a site in privacy and be able to see a doctor online and do that potentially during core business hours rather than having to leave work and go see a doctor. And this would be a pilot program. They would be leasing the kiosks to the SJVIA, which would be much less costly than to have to purchase them. But we would be using the Anthem Wellness Funds to do that. And we're looking at proposing a 2-year pilot program. And one kiosk would be with Tulare County and one with Fresno County. And then the remainder of the wellness funds, they are willing to give to us with gift cards that we can use during our various challenges to help incentivize our employees. That is the SJVIA portion of this wellness item. I would like to share a little information about Tulare County and a wellness activity we just completed, which was our Movember Challenge. In the month of November, we challenged our employees to start with a clean-shaven face and to grow a mustache in support of men's health. It is also our Men's Cancer Awareness Health Month. We have been doing this, was our 4th year, and each year we've had more participation. This year we had a total of 16 participants. And I'm going to ask Lupi to just show we'll go through our before and after photos. One of our RMA employees, this was another RMA resource management employee. Paul Sanpietro from our auditor's office.
Hi.
Grew a mustache and a flag.
Sergio Bustos from RMA. Jimmy Ibarra from RMA.
It was a winner.
John Trist. Javed Khan. Sherman Dix from our RMA and formerly Assessor's Office. Winsy Wu from our Auditor's Office. And Michael Boley from HHSA. Then we had Cass Cook, who is our current county auditor, participate for the first time. Department head joined in. And Clint Sims from our county council. Eric Martin from Human Resources. Roland Hill, our county assessor, participated and actually had to shave his mustache for the first time in 29 years.
Wow.
And there was Chairman Pete Vanderpool, the before and the after. But we're not quite sure what happened to the other half of the after.
Kissing half.
And we had another participant, Supervisor Amy Shutman, who helped and joined in the fun this year. And then we had
I'm Armenian. What can I say? That's only a week's worth of growth.
I think it's a coffee.
And then we thought Fresno County attempted to put in and get in on our challenge, and we weren't sure if that was Paul Nerland before and after, or maybe Oscar Garcia's. So, and then our winners for the best mustache was Cass Cook. Auditor was second place. We had a tie, and Sergio Bustos from RMA. And our first place winner was Jimmy Ibarra from RMA. So we had a little ceremony this week, and they all got their stash sash, which is our honorary trophy that we provide.
Could have took a picture of Gene Rousseau. He had a beard during November.
That's great to hear. I don't know that if we've had him participate here before, but we may need to have a little competition going next year.
But see, he used to work here, so he's kind of in the deal, see, so.
So we thought we would just share that with you.
He's not a
Competition with the
contrarian like
boards
the
next year,
rest
but
of us.
Julie's gone, so I won't have any competitions.
Well, with
Debbie.
Debbie
Debbie's
Pachigi.
gone,
I would
yeah.
like to see a Pachigi and Shucklian matchup. That would be
I
great.
think I win.
Hey, so great item. I think the wellness efforts are really doing well for the counties, and it's kind of interesting to me to see what grabs on in Tulare County versus what takes hold in Fresno County. And the mobile mammography, I think, did really well in Tulare County and didn't do so well in Fresno County. But the online challenges, health challenges, did really well in Fresno County and not so well in Tulare County. So it's interesting, and I wonder if that has anything to do with the HR departments and wellness efforts, what they push amongst their employees, or just really what the interests are. So it'd be interesting to ramp up in wherever we're, like on the mobile mammography in Fresno County, and then in Tulare County, the online health challenges, and really put a concerted effort and really see if it's interest driven or driven by the departments themselves. So,
and I'd just like to say, as far as the mobile mammography, I used it. I was late. I saw it out there, and I thought this is the opportunity to do it, and they got me in. So I think that's very important. And now that'll be, if it's here every year, will be my reminder to do that. So
It worked very well having the mobile bus versus having to get sites and locate sites and make that available. And employees, I know our employees responded very positively to it.
and maybe in the future we can add prostate checks or something for the guys. And
I was thinking rectal exam.
well, that's how they
Oh,
check it.
okay.
That's how they check it. Nathan.
Yeah, that could be a Fresno County driven item.
This is an informational item. Is there any questions regarding our wellness activities?
No, I also think the kiosk, the Anthem kiosks, are a really great pilot, and I'm curious to see what results that will bring as well.
Just to comment on the mammography, I think some of it is our dates. I think Fresno County had one offering of the mobile mammography in October, right before open enrollment. And I think, Tulare, you had two different sets of dates. I'm not sure. It could be the number of times we offered it.
Yeah.
Yeah, so that might be part of
Okay.
it. But I think we need to look at it, and we had great reviews from this new mobile, where the actual bus pulls up, much better than the old way where we actually had someone coming on site with a scanner. So this has been much more positive from the Fresno County's perspective as well.
Good. Okay, any public comment on this item? All right, seeing none. Go ahead.
On the wellness, one more item, and that is we have an open RFP relative to a wellness vendor. And through the process of vetting out the wellness vendors and so forth, it became apparent to us that the needs for the different SJVI entities, County of Fresno, County of Tulare, as well as the membership, that it may not be at this time in the best interest to put forth a substantial financial outlay for a online wellness vendor to correlate all these activities and so forth. So we're going to be reviewing that, and we wanted to, at this point, suspend that RFP and come back to you at a latter point. But we want to make sure that we're addressing all individual needs of the members as well as the SJVIA as a whole more completely. So that's the status of the RFP.
Quick question, because I know when we put out an RFP, or any entity puts out an RFP, the folks that respond put a tremendous amount of effort into responding to that, so lots of time and effort.
Yes.
So a question I would have, are there, with the vendors that responded, is there an opportunity to maybe pick more than one who specialize in different areas to provide what we're looking for, or is that not even really an option?
There are for certain vendors, and for others it was kind of, we're doing everything for you. And I think that was one of the areas that was a little concerning. So there are those opportunities, and I believe what we'll be coming back with is a wellness program that perhaps is a little bit more fragmented in its approach, but holistic in its entirety relative to the needs of the SJVI membership. So yeah, we'll be using especially some of the local vendors. I believe we'll be seeing more of, simply just as with the mammography bus as well too. That was a local vendor that we'll be using.
All right. Okay. Any additional questions or comments? Thank you, Board. Okay, we'll move on to item number 12, which is a request to receive an update on the County of Tulare's ASI fee schedule and approve reallocation of monies.
Borden Darn with Keenan Associates. When we put together the 2018 renewal, it included services for FSA administration for the County of Tulare. Subsequent to putting the renewal together, it was brought to our attention that there's a separate contract for the County of Tulare with Chimente, which includes the identical fee. So the fee was going to be paid 2 times, one through the SJVIA and then once outside. The request came back to us from the County of Tulare to allow that fee to be paid through Chimente and Associates to ASI for FSA administration, and that the $1.25 built into the rates already be recognized as margin that goes on to that to the County of Tulare.
Any questions or comments? No reason to double dip, I don't think. No. All right. Chair will entertain a motion if there's no public comment on this item. Okay.
Move approval, Mr. Chairman.
I have a motion by Director Worthley, a second by Director Shuckley, and all in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. Okay, moving on to item 13, which is a request to receive and file the consultant's medical, dental, and vision experience reports through October 2017.
Okay. Our last time we met as a board, we shared experience through the month of August. We now have the months of September and October that we have the experience reports for as well too. They're detailed in here. We are at a current, or as of October 31st, we're at a surplus position on the self-funded medical program of $1,469,937. In the dental program, we have about $127,000 surplus position, but that really does us no good. It's a fully insured, so that would be considered Delta Dental money. And then the vision is in a minor deficit, $3,980, but again, fully insured. The one thing, when I was last here and reported through August, we were at a position of $1,659,000. In September, that position actually grew to $2,189,000. We're all going, yay, we're going the right way. And then, of course, no single entity, but all 3 entities had large claims in the month of October that hit and were paid, and we dropped from just under $2.2 million to just under $1.5 million. So that's where we are to date. And there's more, but there was large claims for all 3 entities.
Sure, go ahead.
Did any of those trigger reinsurance? So that
Yes,
has that been calculated into the?
Yeah. So anything that's triggered into reinsurance, we actually calculate in the net. So these are net numbers; they're not gross numbers. We're waiting. We may be, from a cash flow perspective, we may be waiting on that reimbursement, but from accrual basis, we've already taken it.
Yeah, question I have, just looking at the employee pool, overall in the last 12 months that you've kind of been paying attention to this, have you seen the mean age of employees decreasing, staying the same, or increasing?
We haven't really looked at the age or the demographics. We can come back and give you that statistic.
And the reason I ask is, so the unusual expenses that hit in October, I want to know if that was just an anomaly, or if we can expect to see more of that based upon trend information. Some of that's driven, of course, by age. Some of it is not. But definitely the older the workforce you have, the more prone to more expensive.
Higher cost.
Yeah. So I'd just be curious to see what your findings are.
Right. From March,
No offense, Steve.
Hey, we've got a couple old ones right there.
Some of us old people are healthy too, you know.
Yeah.
a big portion of Keenan's effort from March, when we first came to work with the SJVI, to now has been really in making sure that contract terms are correct, that you're aligned with the right partners and so forth. Now we're actually starting to look into claim utilization data, and we're hoping that at the strategic meeting that we have in January will be our first report relative to utilization patterns and things that we need to work on from a health perspective and we'll be identifying some of those demographic characteristics.
Okay. Any additional questions or comments from directors, members of the public? Okay, thank you, Warden. We will continue on and take up item 14, which is a request to receive and approve the consultant's report on reinsurance renewal and marketing results, and authorize the president to execute agreement subject to approval of SJVIA council and staff.
Okay. So you have before you the information on the marketing that we did relative to the reinsurance program. We did receive several bids back from the market. Most of them were uncompetitive. Even our incumbent, Highmark, gave us a very non-competitive renewal. It came in closer to 50% increase. We did have a very competitive bid from Voya Financials. Voya is well respected. It used to be ING. They changed their name to Voya. Nobody knows why. But they came in at 10% above our current rate for the current funding level of $450,000. In the renewal that we put together, we also anticipated a 10% increase in the cost of reinsurance. So they came in right at where we expected the reinsurance costs to come in. We also, at this board's direction, asked for a multitude of different quoting layers and so forth. It turns out that the layers that they proposed, and in particular, County of Tulare was interested in perhaps reducing a reduction to $400,000 for the County of Tulare from $450,000 as a reinsurance level. Basically meant there would be about 0.5% that would be higher than the adopted rates for 2018. If we dropped it all the way to $300,000, it'd be just under 2% of rates that we hadn't adopted, or funding that we hadn't adopted, which works out to at the $400,000 level, it was about an additional $122,000, and at the $300,000, it was about $500,000. So the recommendation from Keenan was to move forward with a 450 pooling level. We looked at currently the terms of that $450,000 pooling level is what's considered a 12-15 term. That means incurred in 12 but paid out over 15 months. There's a concern relative to that contract level because let's say we have a large claim that hits towards the end of the year, like now in December. If that large claim is presented in April for payment, which often happens by the time these things settle, it would not have been covered under the contract because it would have been presented for payment after 15 months. And so the recommendation is that we move to a 12-18 contract because typically claims are paid within that 6-month period. We wouldn't have any residual outside of the period. So the recommendation is that we remain with a $450,000 pooling level, and we adopt a 12-18 contract term relative to incurred and paid. Also, one of the areas that we're recommending removing aggregate stop-loss protection. Aggregate stop-loss protection is what you've had it currently in place. Its cost is about $1.19 currently per employee per month, which amounts to about $100,000. We did get a renewal, or through Voya, they were going to charge us $1. But let me explain to you how that protection works. First, it triggers if claims are off by 125%. So our projection for claims is, let's see, I believe it's about $80 million. That means that claims would have to come in about $99 million for us to have $1 million worth of protection. And first of all, if I'm off by 25%, I think you'd have another consultant standing here before you. And second off, basically what I'm telling you is you'd be 19 million in the hole, and from that 19th to 20th million, you'd have reinsurance. So for smaller groups, aggregate stop loss is appropriate. for much smaller, I'd say. But for you at this level, it just doesn't seem worth paying close to $100,000 for $1 million worth of coverage, with the likelihood of receiving that being extremely low. So the recommendation there was that we eliminate the aggregate stop loss. Following those actions means that we would come in about $68,000 below what the adopted rates have in them. So we'd come in below our required level. The other thing is that we discussed risk share. The recommendation is that we not risk share at this point relative to the County of Tulare and the County of Fresno. I think we'll have further discussions. It'll always be a topic of discussion whether you want to risk share or not, but at this point the recommendation is that you not, that we just go into the year based off of those conditions. And I could go through the report in detail if you'd like, or if I'll take any questions. Go you, buddy.
Yeah, go ahead, Director.
Gordon, I was surprised. I thought we left a lot of money on the table last year with HM Insurance. Did we not? In terms of what we paid them in terms of premiums and what the actual claims were?
Yeah, we did. And basically, here's what I can tell you. The reinsurance market, forget the fires. I mean, it's not just health insurance. These reinsurers are over multiple things. I mean, before we had the fires, we had the floods, and we have the storm damages back east.
They're trying to
Now
find ways to get money.
Yeah, so the market has hardened tremendously. And typically, when a market hardens, you want to minimize the amount of reinsurance that you're purchasing. You do want to look at risk share arrangements that can perhaps help you as well, but that's not the recommendation at this time.
I wondered about that, about what you're talking about.
Yeah.
Buyers, I mean, these insurance companies are going to be out billions of dollars, and it's going to be tough. So, but I was just curious. I know we were talking about thinking we could really save some money there because we were in a sense, at that time, overpaying the amount of insurance we were actually collecting.
I will tell you this, that moving forward, the VOIA contract that you're entering into is a dividend-eligible contract. So if your loss ratio is below 65%, there is a dividend that will be returned to you, relative to you. It's typically around 5 to 10%. I think this one's 5% of premium. So there we would be getting a portion of our revenue back. Is also contingent upon renewing them next year, the following year for 2019. So that those conditions would need to be met as well.
The only question that I had is, should there be a time that risk sharing makes sense? Would you just go into the benefit to each entity if that recommendation were to come forward? So what's the point, the tipping point? Do you see risk sharing making sense?
It's basically an inexpensive way of buying down the risk. And there's two things that I want to make perfectly clear. The risk profile of County of Fresno and the risk profile of the County of Tulare are different. First of all, much smaller dependent ratio as far as number of dependents covered under the plan for County of Tulare than there is County of Fresno. So there's more membership here than there is there. That needs to be adjusted for. And in general, you look at the richness of the health plans and what were selected as well too. That'll also have an impact. So those type of factors are taken into consideration when a risk share is developed. Earlier this year, when I showed you some risk share modeling, it was basically we just took the experience under the two groups and said, okay, this is what we've experienced here. This is what we've experienced here. If we trend it forward, this is our risk share pool that we would do. What it does, it allows us to buy down the risk down to it. The recommendation for Tulare was $200,000 level and $250,000 for County of Fresno. And what it basically says is, look, we have an agreement. I don't know what large claims you're going to experience next year in that magnitude. Nobody really does. Actuarially, you're too small to statistically say this is how many large claims in this gap you're going to have. You'd have to be much, much larger than you currently are. And so from that, you basically say, okay, we're going to pay into this pool together on a risk-determined basis, we agree that, Tulare, from 200 to 450, because we still have coverage there, or even at that point, you could go 450, say, no, we'll go to 500 and share at that point. That's kind of open. It basically lets you take less money from the marketplace for reinsurance and say, we'll cover this on our own. And in the risk share arrangement, what we simply do is we say, okay, those claims that hit in that pool will be paid out of the risk share, and it doesn't count towards the experience when we do the renewals. It'll count towards the risk charge that we develop afterwards, and there would have to be a methodology developed for that, for what people think is fair and equitable. But what it really does, it says, okay, you know what, Tulare, I'm just really, for 200,000 and below, that's kind of where I've got to manage my programs to and so forth. And County of Fresno, 250 and below, that's where I would manage it. It's a common practice among larger groups when they come together. But in the same token, we're coming off of large deficits and so on and so forth, and we have time to slowly move into these type of arrangements if we choose to.
Great, thanks for that explanation.
Thank you.
All right, this is an action item. If there's no further questions from directors or members of the public, we can move forward. Chair will entertain a motion. I have a motion from Director Shucklian.
Second.
Second from Director Mendez. Spoke faster than Director Magsig. All in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. See, who said old people aren't on their toes all the time, Nathan? Just saying.
I'm not saying anything.
All right, we're going to move on to take up item 15, take up request to receive the consultant's report update on loan repayment and reserve funding options and provide direction to staff.
Okay, thank you. First, I'd like to comment that we're looking for feedback from the board on this. This is not yet a final document, or at least in my opinion, isn't a final document. I think there's still some adjustments that need to be made prior to finalizing it. At the last board meeting, we were looking at loan repayment. We talked also about IBNR establishment and also a stabilization reserve establishment as well too. So this report, where the previous one talked about just loan repayment, this one talks about all three items that need to be funded. We've taken an approach of looking at if we fund them over 3 years, over 4 years, and over 5 years. So from that perspective, we've got three different approaches here, or the same approach, but over three different time periods. I'd like to draw your attention to the chart that I have on the first page of my report, which shows the 36-month repayment schedule. Thanks. There, first of all, from an equality perspective, we wanted to make sure, and this was one of the issues, that the entities that incurred the deficit position also were tasked with the recovery of that as well too. Whereas the first report really just said, you got this many enrolled, here's the cost. So from here you can see on a loan repayment schedule of the $9 million that was lent, County of Fresno would be just under $7.6 million, County of Tulare just under $1 million, and the City of Marysville $443,000. Now, there is an issue with the City of Marysville as well too, because technically at one point that was the all other group, but there's only one remaining in 2018. So, and this is where I think one of the adjustments, one of the things that might need to be smooth, because if we follow this as is outlined, City of Marysville is tasked with returning the all other deficit position, which is an incredible burden. Over 5 years, it would add 11.1% to rates. Over 3 years, 18%. That's just for that component. So there's some smoothing that needs to happen there. We may want to look at something for them, such as that it should not be any different than perhaps some average of the County of Tulare.
Yeah.
Because the bottom line is this: if we put even 11 points or 18 points on the City of Marysville for 2019, they're going to go elsewhere, and then that whole burden will shift back to County of Tulare and Fresno. And
Just a quick comment. I would say, I mean, smoothing I don't think is the answer. I would say that we need to figure out what their proportionate share is relative to their numbers, and then we just have to eat. We have to eat whatever everybody else has lost. It's not their fault.
I would agree. I'm in complete agreement on that.
Okay, we'll make that adjustment then. Okay.
Yeah, that was very astute commentary by such a young supervisor. Just saying.
I learned from my sage supervisor to my right, Buddy Mendez.
So I think the important component here is, well, first of all, the required IBNR, 5.7 million is what's currently being calculated. The required stabilization, keep in mind, ideally we'd have a 3-month stabilization. That is a 1-month stabilization at 5.9 million. If we did that times 3, this would really look off. And so I kind of said, okay, let's just do a 1-month target at first. And one of the things that's real important is that we update this every 6 months. So, I think it's important that if we were to start this effective 1/1/19, that based off of data that I give you through June, which would hopefully be discussed right at renewal time, that's where we will place it. And then we'll review it again once at the end of the year, just to make sure that we are on target, with no adjustments necessarily being made. Because hopefully some of our plans will be doing better, we'll be improving the health status and so forth by introducing new programs. So if we did it to fund those items, which is just over $20.6 million, you can see the percentages of what an adjustment to rates would be. There's the 9.3% to County of Fresno and 6.4% to County of Tulare, and like I mentioned, 18.5% to County of Marysville, or City of Marysville. We also did based off of a 48 and a 60-month or 5-year repayment option, and there you can see things start to become a little bit more reasonable. For County of Fresno, over 48 months, it would be 7%. For County of Tulare, it would be 4.8%. County of Fresno, over 5 years, 5.6, 3.8 for County of Tulare. So those, and keep in mind that as surpluses accumulate, and hopefully they will accumulate, especially in the upcoming year, those will be offset by some of these numbers that we're seeing here as well too. And we'll be applying those.
Sure.
Yeah, sure.
I'm looking at these, and I don't know what these mean to our Fresno County. I mean, obviously they have an impact for both counties, but in terms of priorities, I'm wondering if there isn't a higher priority on the IBNR and the stabilization than there is on the repayment of the loans, because as you say, if we're able to build reserves, and then we have litigation that may enter into this process, and depending on where the counties sit financially today, maybe we want to focus on the IBNR and the stabilization accounts, and maybe even bump that up from 1 month to 2 months, and sort of hold back on repayment of the larger sums. I'm just throwing that out there as a possibility. We know we need to deal with the IBNR and the stabilization. The other monies have already been spent; they're already gone, and we need to deal with that issue down the road. But I'm just wondering if there's not a higher priority for the IBNR and the stabilization accounts.
There's the priority for the loan repayment is really a question for SJVIA Council and the managers for the SJVIA, as opposed to myself.
And also our CAO. I mean, because our CAO is going to be looking at our budgetary constraints and what is it that's affordable for the county and that sort of thing.
I would just say, Paul Nerlin, SJVI manager, this is an item where we're looking for direction, and that is potential direction. Is if philosophically, and this could be discussed in the strategic planning meeting as well, we want to focus on, I'll just say, becoming a more healthy JPA first, and then we modify our loan agreements accordingly to where we're in a better position. That is an option, obviously, in collaboration with discussion with our various counties and the impact.
And Paul, I believe on that strategic planning team is Steve and I. Is that correct?
That's correct.
You know you're on that team?
I remember I missed the meeting, and I think that's...
There you go.
What can we stick Borges with?
Yeah.
Yeah, we should put him on something today.
Hey, you want something accomplished? Stick with your team.
Yeah, because the senator will never show up. He's got so many different commitments with Christmas programs and such.
Well, anyway, I throw that out there. I don't know what other people think, but...
No, I thought that was a good idea. Yeah.
Another possible direction as I'm going to come back to you with two areas in particular. One is this model does not take into consideration the prescription drug rebates that we receive from the carriers. And initially it was thought that it may be partially in, that needs to be investigated a little bit more. So that would have an impact on dollars available to fund these certain type of items, and also adjust the deficit position that we have downward if we haven't taken those rebates into consideration. So that's the one area. The other area I'll come in back to you with is relative to the city of Marysville as well. There's always a direction that can be given that we cap it in any given year, that the increase due to these three items is of a certain percentage. And we just say, until we accumulate what we need to accumulate, and let it go kind of from that perspective. So
and another way that we could even look at it too is, let's say the performance is outstanding by both the County of Fresno, County of Tulare, and the City of Marysville, and we realize negative rates and rate decreases, that we don't implement them and we just hold it at a no increase, and we can build up that way as well.
Exactly. Yeah.
All right. Any additional comments or direction? Is there any new committee we can create to put Borges on? Maybe? Or Crocker?
So
Crocker?
we need to meet then, Nathan and I with staff after today's meeting and a subsequent meeting. And
Has that meeting day been set?
Yes, but our next item here is to talk about that.
Okay.
Item 16 today.
That we'll come back with a more refined recommendation.
Okay.
That kind of concludes.
Okay. Are there any public comments to this item? All right. Moving on, we will take up item 16, which is a request to receive the consultant's report, an update on upcoming SJVIA strategy meeting.
Board, I'll just start this.
Sure.
We have set the date. The date of this meeting will be January 26th of the new year. The location is still being determined, so bear with us. Director Wordley and Magzig will get back to you and try to come up with something convenient for both of you and us. One of the things we want to talk about with you in this meeting for sure is just where are we headed as a JPA, what are our goals, some of the things we just talked about here. This item was added simply to add to the whole board. Are there things you as a board would like us to discuss in this session specifically, and we'll make sure to add that to the agenda. Or if you want to add anything to what I just said.
I think something that we can, something that should be analyzed at least is what is the strategy going forward in terms of growth of the entity. I mean, there are other ways that we can deal with the restabilization and the increase of reserves, paying back loans, and that is by offering other entities rates that are more competitive than what they're being offered by their current carrier, their current organization that they're working with. And if we can do that and at the same time responsibly consider their impact on the SJVIA, we might find ourselves in a position to where we don't have to bear the burden of basically covering for other entities. I doubt we're going to get any of the ones that were with us back, but maybe there are other entities out there that could come back in, maybe help lessen the burden on our counties to make up for what was lost by some of the entities that we did not know about that had joined previously. I think that's something we have to evaluate at some point.
And I would add, if we ever consider a growth strategy again, we may want to consider rebranding, a new direction, just because of where we've been. So,
okay.
So on that point, looking at lessons learned. So when the SJVIA was formed, where we were, where we are today, and then moving forward, things that I want for the current members, the 3 member entities that are involved with SJVIA, we need to be delivering the highest quality level of service to our customers, which are our county and city employees, at the lowest possible price. To me, that is what needs to drive everything that we do. And obviously, we've learned what not to do in many cases, so let's take a look at that. And we still have a lot to learn, I think, moving forward as well. And our new consultant can help us identify strategies to make sure that we continue to get stronger moving forward. So I would want to take a look at our mission, vision, and value statements that we currently have, make sure that they still are appropriate for where we're heading into the future. If not, retool those, and then from there, I think everything else can grow. And we don't have to solve everything at the strategic planning meeting, but it's just moving us in a direction forward, making sure that the pillars that this entity is built on are still appropriate, and if not, then let's retool some things.
right, thank you.
Okay. Any additional questions or comments from directors, members of the public? All right. Seeing none, hope that was clear enough direction. We will move on now to item 17, which is a request to approve the revised 2018 SJVIA board meeting calendar. I'll just ask, what is the change on dates there? Because I don't have the old calendar. I was looking at my phone
it is
trying
the
to find it.
February board date has moved forward one week because of the holiday.
23rd.
Yeah, it's moving to the 23rd, so that's the one change to the calendar.
And then why is it at the Facera boardroom instead of the Fresno? Is the board occupied, or what was the reasoning behind that?
I believe so. Larry, is that the case? Yes. So for that's the reason that wasn't there.
Well, I'm the audit committee chair, so
you move
I
your
can't be at
meeting?
both meetings.
Yeah.
So Oscar, what do you think? What do you think we need to do? Let's take a look. Let's see if we can maybe move the audit committee meeting to have it the same day, but maybe move it later.
Yes.
See if we can do that.
And move it back to the boardroom.
Boardroom, yes. Yeah. I don't
right,
like,
let's do that.
I don't like bouncing all over either. Yeah.
Hard.
And it looks like going forward, that's where we'll be.
And maybe if you could help Tulare County directors with some security clearances there, because getting to the Fresno County Board of Supervisors chamber, man, that's like getting into a prison. You guys are so heavily secured there. It's difficult for us to find parking. I mean, come on, you got to help us. You know, we're just from Tulare County. We're not urban folk like you guys in Fresno County.
We will make sure parking, especially, you've got
Thank
all
you.
worked out and
Appreciate it.
the directions.
I would like to add that we may need to come back at a future meeting and look at the December 7th date. We just found out this last week the California Labor Conference happens to be that same week again in December. They just issued
That would be
their
fine.
date. So that affects both staffs as well as a lot of our vendors as well as Keenan.
Just push it ahead 1 week right now.
We weren't invited to the labor conference.
Nor will we be.
Yeah.
We extend
side
our
of our
invitation.
parking
You
lot
can
you
join
actually
the staffs and all the vendors.
Good stuff.
I'm okay moving that date. So maybe you guys can just talk to our staffs, find out another date in December that's workable, and we'll just do that.
Okay. Anything else on this item? All right, seeing none, we've given direction. Do we need to take formal action since we're making additional changes? Okay. We have a motion by Director Worthley.
Second.
Second by Director Pacheco. All those in favor, please signify by saying aye. Aye. All opposed, the same. Motion passes unanimously. We'll next move on to Director Strickland's favorite item on the agenda. That's item 18, adjournment. Thank you all for attending today's meeting. Have a wonderful weekend and a very merry holiday season.
Merry Christmas.
I'll see some of you
Feliz Navidad.
between now and then. We have an air board meeting next week.
Oh, I am
Thank you for
going to that
attending.
Alta GSA meeting.